SARS-CoV-2, one of the 7 coronaviruses, poses a deadly health threat to humankind. Its transmission is like a wildfire, affecting millions of people around the globe. The Philippines was not spared from this deadly virus. From the moment the World Health Organization announced a pandemic outbreak last March 11, 2020, the government made necessary preventive measures to protect its people from acquiring COVID-19. Under the leadership of President Rodrigo Duterte, the Philippines were put into enhanced community quarantine last March 16, 2020, restricting the movement of the population, except for essential activities. The implementation of the Luzon YDCQ was somehow effective in slowing down the spread of COVID-19. Under the modified enhanced community quarantine, people are now permitted to go outside, provided that they will abide by the minimum preventive measures. In this case, an influx of active cases was noted. Unfortunately, COVID-19 cases skyrocketed after placing some parts of the country under general community quarantine. The numbers continue to increase day by day. As of August 1, 2020, there are 98,232 active cases in the Philippines. 2,039 people died due to COVID-19 and its complications. And there are 65,265 people who recovered from this disease. Due to increasing cases, the hospitals are overwhelmed, with the influx of patients tagged as probable, suspect, or confirmed cases of COVID-19. Now, they are experiencing tight resources to provide safe and effective medical and nursing management to their patients. Healthcare workers are exhausted to cope up with the increasing number of patients admitted in the hospital due to COVID-19. Their hands, the one who actively give comfort, are worn out. Their faces, the reflection of the present, are bruised and bleeding. Their body, as a temple of the soul, is too weak. Their eyes, who recognize your pain and suffering, are too tired. Their brains, as the controller of the situation, are too drained. And their hearts, who hopes for the best, are too desperate to be heard. Healthcare workers are now raising their voices, ardently desiring to be heard by the government, under the leadership of President Rodrigo Duterte, for a 2-week timeout, and to put National Capital Region into enhanced community quarantine, to assess and recommend corrective and preventive measures, to strengthen the plan against COVID-19. Will they heed the call of our frontliners? Is economic health better than public health? Is granting of 2-week enhanced community quarantine will result to economic devastation? Or, granting the plea of our frontliners will result to a much better result for both sides? This is Health and Society, and we thank you for listening. Share us your thoughts. To know more about any health-related topics or issues, do not forget to subscribe to our YouTube channel and like our Facebook page.